So good morning, good afternoon, and good evening. Thank you for joining us today. Before we get started, just a few logistics. To select your preferred language, please click on the interpretation icon on the bottom right of your screen, the one that looks like a globe, and select your preferred language. And from your mobile phone, you can do this under meeting controls. You'll press the three dots and then press language interpretation, and you can select English or French. Most of the presentations today will have French subtitles. Otherwise, simultaneous translation will be available. Please take note that when a presentation has translated subtitles, there will be no additional simultaneous interpretation. So for today, we encourage you to use the chat to ask questions in English or French at any time to the group or directly to any of the moderators if you need technical assistance. We'll be using Mentimeter today. You can use this on your phone, tablet, or laptop, and we'll provide instructions on how to access and use Mentimeter in a few minutes. QR codes and links via the chat will be provided throughout the webinar for you to access resources and tools. And the webinar recording, presentation, and links to resources will also be shared by email. To get us started, I'm very excited to first turn things over to Foyeke Oyedokun-Aragbabo, Project Management Specialist for SBC in the Health, Population, and Nutrition Office at the USAID Mission in Nigeria. Foyeke, good morning, and over to you.
Thank you, Amanda, and I hope you can all hear me okay.
Yes, we can. Thank you.
Thank you. So good morning, good afternoon, and good evening, everyone, depending on where you're joining us from. It's really great to have you here with us today. Thank you for taking the time out of your really busy schedules to be a part of today's event. I'm very pleased to be able to welcome you to the third event in a four-part series of legacy and learning webinars that have been organized by Breakthrough Research. For those of us who may not be so familiar with Breakthrough Research is USAID's flagship social behavior change research and evaluation project. And Breakthrough Research drives the generation, packaging, and use of innovative SBC research to inform programming. It's been implemented from August 2017 and will continue until July 2023. And is led by the Population Council in collaboration with consortium partners such as the Tulane University, Avenir Health, Population Reference Bureau, Institute for Reproductive Health at Georgetown University, and Ideas 42. So Breakthrough Research works really closely with a sister project called Breakthrough Action, as well as several other implementing partners that are working on social behavior change and service delivery. So the project's approach is to foster collaboration and shared learning and ensure that SBC programs are based on what works while continuing to elevate the impact of evidence-based SBC programs and put evidence into practice. USAID's investment, including in Nigeria, in social behavior change programming for family planning, as for several decades now, been hinged on the evidence that beyond the individual cognitive and social determinants, that there are several direct and indirect factors within the broader structural environment that exerts both positive and negative influences on the adoption and sustained practice of family planning behaviors, and ultimately how we achieve our family planning outcomes. So today's event will definitely help to highlight some of those shared learnings, insights, and evidence on ways that SBC approaches can best support family planning programs, outcomes and goals through fostering an enabling environment. And we do know that conditions in which people work, conditions in which they are born, conditions in which they grow and they age, whether they have access to resources, whether there's equal, the unequal distribution of social and economic conditions, the policies, the regulations and finances, the governance structures, all of these are all critical and interrelated components of an enabling environment. And these and more can be modulated through SBC and other approaches to just make sure that individuals, couples, communities, and households are able to make voluntary and informed family planning choices and decisions. And this kind of holistic and social systems approach to SBC program is quite important to USAID's core development value, and sits at the center of our goal to always create lasting sustainable change. So with this, I will hand you over back to Laura, who is the Project Director for Breakthrough Research, for her remarks. Thank you. And again, thanks for joining us.
Thank you so much, Foyeke. I also want to welcome everyone to today's webinar. Breakthrough Research has had a productive 6 years, and I want to share a quick snapshot of a few of our metrics. The project has worked in 19 countries and engaged with 21 global and country partners on 53 research studies. This has resulted in 27 peer-reviewed publications and 94 citations to date across the 4 priority technical areas of the project: provider behavior change, SBC in the enabling environment, advancing SBC measurement, and costing for SBC. Today's webinar is the third of 4 complementary legacy and learning webinars. These webinars are intended for programmers, researchers, development partners, and donors, and are designed to be an interactive learning opportunity. Please join us for the full complement of this legacy and learning series. More information will be shared at the end of today's session. And welcome back to those of you who joined us for either of our first 2 legacy and learning webinars on provider behavior change and SBC approaches to improving quality of care and family planning, and advancing SBC measurement for family planning. If you missed those, you can use the links in the chat to access the recording, resources, and webinar slide decks. For this webinar, we'll highlight evidence, insights, and learnings from the past 6 years from Breakthrough Research's work to support a better understanding of the enabling environment for SBC and its application in improving family planning program design and implementation. First, we'll start by briefly setting the scene for SBC and the enabling environment. Next, through a series of short and interactive presentations, we'll share some of Breakthrough Research's state-of-the-art evidence the project has produced over the past 6 years to build a better understanding of how SBC and the enabling environment interact, and how this strengthened understanding can help to support family planning programs. We'll then share some reflections based on our learnings as a project on what's needed next to continue to build this evidence base as we look to the future of SBC and the enabling environment for family planning programs. I'll now turn it over to Amanda Calamar, the Technical Director for Breakthrough Research. Amanda.
Thanks so much, Laura. As mentioned at the start, we'll use Mentimeter throughout the webinar today as a way to hear from you all. If you joined us for a previous webinar in our series, this will be very familiar to you. For those of you that are new to the webinar series today, you can access Mentimeter through your phone or your laptop. If you're using your phone, you can use the QR code on the screen. Scanning it will take you directly to our page on Mentimeter. And on your phone or your laptop, you can also go to menti.com and enter the code that you see on the screen here, 44538355. And this will take you directly to our page on Mentimeter. We'll give everyone a minute to get there. And then once you're there, if you can go ahead and click the thumbs up on the page it brings you to, that will let us know how many people have successfully connected to Mentimeter. Great, I'm seeing some thumbs up. I'll give people just another few seconds to get here. Make sure that everyone's with us. Wonderful. Okay, so we're going to go ahead and get started on our Mentimeter questions. So first, please use this map and drop a pin to let us know where you're joining this webinar from today. You can do this by placing the blue dot near your geographic location and then pressing submit. and you'll see the results live on the screen here. Wonderful. It's great to see colleagues from so many different locations around the globe. I'm very happy to have you here. Great. So we'll go ahead and move to the next question. So to get us started, do you use SBC approaches as part of your work? And please tell us if yes, you do, no, you don't, or if you don't know or aren't unsure. Great, it looks like the majority of you do, and there's some no's and I don't knows. And so hopefully after today's webinar, you'll have some evidence needed to incorporate some SBC approaches to support your work in your programs. So moving to the next question. Which components of the enabling environment is your current work most related to? So is it related to policies, legislation, and financing? Or are you closely working on social and economic factors? Is it more related to institutions, collaborative governance and management, or none of the above? Great. So it looks like about half working on social and economic factors and equal parts on institutions, governance management, and policies, legislation, finance. Great. And finally, we'd like to know a bit about who is joining us today. We now know where you're from, but do you consider yourself to be a program designer or implementer, to be a researcher or M&E officer, or are you a donor or a stakeholder or policymaker? Great to see such a mix of people with us on the webinar. There'll be something for everybody in today's webinar. And so thank you for your participation in this first Mentimeter. It's our way to hear from you. It's great to hear from you. And we look forward to your participation via Mentimeter again in a few minutes. So keep Mentimeter close by. So first, we're going to set the scene for SBC and the enabling environment and dive into the evidence. So let's go ahead and get started.
Family planning programs are often faced with the challenge of transferring knowledge into behavior. A wide variety of contextual factors influence the conditions for action and non-action. An enabling environment for voluntary rights-based family planning brings together three interrelated groups of practices: policies, legislation, and financing, institutions, governance, and management, and social and economic factors. Given the link between individual and community level beliefs in myths and misconceptions that can impact the use of modern contraception, a supportive enabling environment understands and addresses knowledge gaps, myths, and misconceptions through education, particularly girls' education, and through interventions such as information campaigns that can seek to improve knowledge and dispel those myths. Understanding what and who influences attitudes, norms, and beliefs, and what sources of information are trusted by women and men can help to shape how SBC programs and interventions are delivered and through what channels. Additionally, community engagement that promotes a more supportive enabling environment for family planning, acceptance, and use should address norms around family planning, norms around communication and decision-making, and gender norms that affect men's attitudes and their engagement in decisions related to the use of family planning, while also respecting women's autonomy. We can then further think about this enabling environment and its intersection with SBC approaches. The interaction within this nexus, here in the overlap of this diagram, can go both ways. The enabling environment can act on SBC approaches in a way that facilitates or creates barriers, while SBC approaches can identify areas where the enabling environment could be strengthened and then work to create a more supportive environment. Over the course of the next hour or so, we'll share what breakthrough research has been doing to further unpack this intersection of SBC and the enabling environment. To do this, we'll be sharing just a selection of our work over the past 6 years, organized around key messages we'd like to leave you with. The links that we provide throughout the webinar can be used to go deeper into the evidence shared. We'll also share a link at the end of the webinar to a collection of a larger body of breakthrough research's work on SBC and the enabling environment and on integrated SBC, where much of this work is derived from. A first key message for today. SBC approaches can best support family planning programs to achieve their goals when the context of the enabling environment is clearly defined and measured, better elucidating the pathways by which behavioral determinants influence health outcomes. To dive a little deeper into this key message, we'll highlight some of the evidence that breakthrough research has generated over the past 6 years, outlining different ways SBC and the enabling environment interact, and how this deepened understanding can help to support family planning programs. You'll hear from those on the breakthrough research team involved in developing these resources, and they will be available at the end of the webinar to answer questions. Over to you, Sanyukta.
Greetings, colleagues. My name is Sanyukta Mathur, and I'm a social and behavioral scientist at the Population Council. I've had the pleasure of serving as the technical advisor on gender and youth on breakthrough research, and led the process toward developing research and learning agendas on 2 programmatic themes that emerged as key priorities in the SBC field: provider behavior change and integrated SBC programs. At the start of the project, in collaboration with USAID and building on past efforts, we took an intentional, consensus-driven approach to develop global SBC research and learning agendas. We engaged over 190 partners in this process, including researchers, implementing partners, service delivery organizations, as well as donors. The RLA for Advancing Integrated SBC Programming lays out a set of questions to prompt the generation of knowledge that advance efficiency and effectiveness of integrated SBC programs. In this RLA, experts identified implementing in an enabling environment as a key evidence gap, in addition to questions about intervention content and programmatic model, effectiveness of the integrated approach, and costing of the integrated approach. The RLA discussions touched on how the enabling environment needed for integrated SBC programs is different from more vertical programming and the limited evidence available on this critical component. The RLA thus articulates 2 broad primary research and learning questions on this topic. First, what are the conditions, for instance, political or donor support, capacity and coordination, that enable or hinder design for appropriate and feasible implementation of integrated SBC programming? And second, what are the conditions that enable effective adaptation and sustainability of integrated SBC programs? Lessons generated from the research and learning questions to fill these evidence gaps about the enabling environment have applicability across a range of health areas, including family planning, for strengthened programming and sustained outcomes. Please scan the QR code to learn more. Thank you for listening.
Thanks, Sanyukta. And next over to Leanne to share with us some highlights from a review of the evidence, including of the enabling environment that informed an integrated SBC program in mental health.
Hello, my name is Leanne Doherty, and I will be sharing some of our evidence to inform integrated social and behavior change in the Sahel. Governments and donors in the Sahel recognize the need for strengthening state and local institutions and governance, increasing sustained economic well-being, and improving health and nutrition. Interest has grown in the viability of building upon existing humanitarian and development assistance to cohesively address more than one health and development issue within integrated programs. Breakthrough Research conducted a literature review to generate evidence for integrated social and behavior change in the Sahel. Findings from the evidence review helped to identify persistent knowledge gaps, myths, and misperceptions and norms that influence health behaviors. The review found that many of the health behaviors included in the review are practiced by women but are influenced by their parents, husbands, friends, and community leaders. Family planning programs that seek to address family planning in the Sahel, including through integrated programming addressing multiple behaviors, need to determine how to influence these audiences by understanding how information is shared within communities, including which sources of information are most frequently accessed and trusted, and how these figures of influence can be engaged to support adoption of priority behaviors. You can learn more and access these documents by scanning the QR code to access the web link.
Thank you, Leanne. Given the identified evidence needs and review of the literature just shared, we know that an enabling environment for sustainable SBC and family planning programs promotes and incorporates structural, community, and individual drivers of change for a more complete understanding of the pathway from knowledge to behavior. Breakthrough Research has generated evidence under two portfolios of work, one in Niger and one in Nigeria, that have, in part, helped to better clarify the intersection and interaction of SBC and the enabling environment. To explore this evidence, you'll hear from those on the Breakthrough Research team involved in those studies, and they'll also be available at the end to answer questions.
Hello, I am Adolo Aisiri, Director of Research, Evaluation and Knowledge Management in the Abuja Office of Breakthrough Research. To fill in some of the evidence gaps identified through the research learning agenda, Breakthrough Research conducted a 3-year evaluation in Northwest Nigeria of the Breakthrough Action Nigeria project, which is an integrated SBC program targeting family planning, malaria, and maternal, newborn, and child health and nutrition. Northwestern Nigeria is a region with high fertility and low contraceptive use, driven in large part by high fertility norms, pronatal cultural and religious beliefs, misconceptions about contraceptive methods, and gender inequalities. SBC programs often try to shift drivers of high fertility through multiple channels, including mass and social media, as well as community level group and interpersonal activities. The evaluation sought to assist SBC programs to better tailor their efforts by assessing the effects of intermediate determinants of contraceptive use and by demonstrating their potential impacts on contraceptive use, interpersonal communication with partners, and contraceptive approval. A better understanding of these psychosocial factors can help elucidate where a more supportive enabling environment is needed and how SBC approaches can strengthen that support, e.g. through campaigns that dispel myths or through male engagement activities that seek to shift gender norms. For this study, called the Behavioral Sentinel Surveillance or the BSS study, we focused on women with children under age 2 living within the Breakthrough Action Nigeria program areas in Kebbi, Sokoto, and Zamfara states. The data were cross-sectional, meaning that we had different samples of men and women at baseline and endline. The sample included over 3,000 women, and we used multivariate regression analysis to look at how intermediate determinants such as values, beliefs, and norms are associated with FP outcomes. Now, to estimate what SBC programs can potentially achieve, we simulated the magnitude of improvements in FP outcomes that could be achieved in a world with improved ideation, that is, for example, if everyone had correct knowledge and held no contraceptive myths, or if everyone had positive beliefs surrounding FP, or if everyone approved of FP. Now we looked at these impacts across the different domains of the additional model, which is knowledge and risk perceptions, beliefs, values, norms, self-efficacy, and social influences. From our analysis, we found that values, specifically approval of FP, appear to have the largest impacts in general. For example, if all women approve of FP for spacing, the estimated regression models indicated that contraceptive use could increase by 11 percentage points. Intention to use contraception in the next 6 months could increase by 20 percentage points, and the likelihood of discussing FP with one's husband could increase by 25 percentage points. Achieving ideal knowledge and dispelling contraceptive myths amongst women could also have potentially large impacts, being associated with a greater likelihood of using contraception, a greater likelihood of intending to use contraception, and increased approval of FP. Social influences were far from negligible, influencing each outcome by 9 percentage points or more. Please kindly use the QR code to dive deeper into the evidence.
Thank you, Adelar. To complement the BSS evaluation of individual behaviors and behavioral ideations and influences, Breakthrough Research developed a set of qualitative studies that aim to help answer the RLA questions about the conditions that enable or hinder effective SBC programming. These studies also explored the multiple pathways of drivers, structural, community, and individual, that intersect to affect behavior change, including for family planning program, and the implications of this for program effectiveness and sustainability. Now, over to Adetayo to start off a short series of presentations of the qualitative studies that explored this intersection of individual, community, and institutional influences.
My name is Adetayo Adetunji, and I'm a research analyst at Breakthrough Research Nigeria. One of the first qualitative studies we conducted to better understand this intersection between individual, community, and institutional influences was a qualitative evaluation of Breakthrough Action Nigeria's Advocacy Core Group, or ACG model. The ACG model, as part of Breakthrough Action Nigeria's broader SBC programming in Nigeria, is a formalized structure of social groups that work through key opinion leaders and influences to affect community level health norms and individual behaviors. You see here some of the responsibilities of ACG members, including working to address barriers, wrongful beliefs and misconceptions on RMNCHN interventions, facilitating the dissemination of correct information on RMNCHN interventions, including childbirth spacing through mass media, and advocating to governments, communities, non-governmental organizations, relevant institutions, and other stakeholders for resources and support. My name is Adetayo Adetunji. First, here are some highlights of our findings related to both social norms and to creating a more supportive environment for discussion and decision-making among couples. Although social norms are entrenched, that norms around child spacing are beginning to shift, with a recognition of the benefits to mothers and children's health. However, women do not have the agency to make health decisions and to independently take action to seek care in family planning, pregnancy, childbirth, and childcare. Both women and men viewed men as the decision makers, and women were required to seek permission from their husbands before making health-related decisions for themselves or for their children, reflecting unequal power relations. The decision-making power of men was reinforced by culture, religion, and the dependence on men to meet families' financial needs. There is the perception that it is a wife's responsibility to convince her husband of the need for health services, perhaps through enlisting the support of mothers-in-law, religious leaders, and traditional leaders. To address this, ACGs appear to be fulfilling their responsibilities by actively discussing and encouraging shared decision-making on health matters. This has led to perception of shifts towards more shared decision-making, particularly with respect to ANC and facility-based deliveries. In thinking about the enabling environment, understanding the ecosystem of influencers on health-seeking behavior is also important. Here on the screen is just one example of our analysis of influencers in maternal and childcare in Bauchi State. The influence of others on healthy behaviors is important, but not always consistent across different health behaviors. For example, women in Bauchi State report a great deal of spousal influence on child spacing decisions, but less so for decisions about ANC and immunization, where family and healthcare providers were most influential. Overall, our study found several promising areas for potential impact of SBC delivered through the ACG model to support a range of health behaviors, including family planning. First, ACG members described receiving supportive training from BA on how to mobilize communities, which is beneficial even beyond their roles as health advocates. They further reported that the formalized structure of the ACG program provides a good entry to communities and serves as an important conduit by which district heads can reach those communities, again providing useful community support beyond health. Using a combination of mid and mass media is promising. ACG members noted that their work has been bolstered by radio broadcasters transmitting similar SBC messages, lending credibility and support to their own work, reinforcing health messaging and reaching broader audiences. The complementarity between the ACG model and the mass media SBC, a central component of Breakthrough Action Nigeria approach, may warrant further exploration and could serve as promising avenue for future SBC programming and expansion. The ACG model setup appears to support its success. The structure of the ACG model, based on close liaison and social support from government leaders at all levels to mobilize and reach communities of interest, provides a source of intrinsic motivation to ACG members. In spite of the lack of financial remuneration, members feel empowered to do their work, given the strong social connections and support for advocacy. As a result, ACG members may find the work inherently rewarding, a fact that speaks to the overall operability and potential sustainability of the model. And finally, the potential of ACGs to influence health appears to be strong, yet it can vary by geography and health topic. For example, analysis of information flows in Sokoto shows that respondents were influenced by religious or traditional leaders for ANC immunizations and child spacing, with traditional leaders appearing to be more influential than religious leaders. This would appear to indicate that the ACGs in Sokoto could continue to serve as an important source of information and motivation to improve the health of community members. This has been a snapshot of what is a very rich set of findings. To explore this and more, scan the QR code to access the study report.
Thank you so much, Adetayo. And now we'd like to hear from you all again using Mentimeter. So please go back to where you left off on Mentimeter, or if you need to rejoin us, please go to menti.com and enter the code that you see on the screen here, or use the QR code to take you to Mentimeter. Great, I'm seeing some thumbs up, so it seems that most of you have rejoined us again, so great. So now that we've heard about the advocacy core group model study from Adebayo, a couple of questions. First, a pulse check. Were you surprised that the social influences of health behaviors were different depending on the behavior? Right. So it looks like many of you weren't, but there is some surprise in there. So hopefully diving deeper into the evidence helps you look more into that and explore more about that. And as a next question, so in a short sentence, can you tell us what barriers you've encountered in your work when implementing models such as the ACG model that leverages community leaders or opinion leaders? What barriers have you encountered? You can go ahead and type the short sentence and hit submit, and we'll see. Yeah, so we'll see the responses here live on the screen as they come in. Great, lots of barriers here. And I'm seeing some coalescing around some barriers related to social norms and gender norms, a little bit of which Adebayo shared in terms of findings from the ACG study. And Adebayo, I think you're on the line, and if you're able to unmute yourself, wonder if you might be able to provide a short reflection on these barriers around gender norms and social norms, and perhaps some of what you saw in the data from the ACG model study that suggested some of these norms might be starting to shift.
Yeah. Thank you very much. So just reflecting on some of the responses I'm seeing here, I'm seeing a lot of norms, gender norms, social norms, and this is exactly what has been going on. I mean, due to held in place, of course, by a lot of factors at community, states, and national level. And this is also backed by different evidence that has come out of the northern region of Nigeria over the past couple of years. And like many have said here, I'm not surprised that this is still the case. And of course, we hope that we've been able to generate, evidence that is, very helpful to help solve this issue going forward. Over.
Great, thanks so much, Adebayo, and thank you to you all again for your participation in this Mentimeter. It's always great to hear from you. And so please keep Mentimeter close by. We'll use it again in a few minutes. But for now, we're going to head back over to Martha to highlight some findings from our evaluation of a community capacity strengthening model.
Hello, my name is Martha Silva, and I'm the Data Strategist and Innovation Team Lead for Breakthrough Research. We conducted a midterm evaluation of our sister project Breakthrough Action's Community Capacity Strengthening approach in Nigeria. This approach was designed to help communities to identify priority health areas and behaviors in family planning, maternal neonatal child health and nutrition, and malaria, and empower community organizations, namely ward development committees, to mobilize resources, enhance participation in health services, and address underlying barriers to improved health. The community capacity strengthening approach also targeted barriers such as restrictive gender norms and promoted joint decision making. This approach also aimed to increase community ownership, and sustainability by developing systems to ensure continued community involvement and participation. The evaluation that Breakthrough Research conducted used a qualitative approach based on a total of 49 in-depth interviews with community committee members, community volunteers, traditional leaders, and local government officials. In terms of early successes, we found that as a whole, community committees are described by all categories of stakeholders as making improvements in health facilities and transportation conditions, and projecting a high level of capacity. Successes we highlighted include facility improvement, maintenance, and infrastructure, as well as acquisition of needed equipment. Social cohesion was evident not only within, but also across committees and community volunteers, which, as you can see in the quote on this slide, describes the different actors like a broom tied together. Trust is a key element contributing to this sense of cohesion, as is transparency and accountability that is expected of leadership within these community structures. Our study report also highlights challenges to sustainability. We found that the resource mobilization strategies that ward development committees have used so far are mostly limited to fundraising within their own membership or other prominent community members. Structural and logistical factors related to difficulties to reach more remote settings also continue to challenge the sustainability of programmatic efforts, highlighting the need to continue to advocate for structural changes from ward or state level authorities. Additionally, local government officials' willingness, ability, and capacity to provide supportive supervision and continued motivation will be key to determine sustainability of the work done under the community capacity strengthening approach and in support of community level social and behavior change. There was a perceived potential for waning motivation after the end of project implementation. Key recommendations include supporting the diversification of committees' fund generation strategies. The study found a limited number of funding strategies with high reliance on self-funding and a potential threat to the sustainability of the community capacity strengthening approach if diverse funding sources are not identified. Secondly, strengthen capacity for addressing a wider range of behavior influences sustaining change, including practicing holding government and other stakeholders accountable to their commitments to support community health and advocacy. Thirdly, further promote female participation in ward development committees and community structure leadership. Social and gender norms restricting the ability of women to serve within community structures and limiting women's healthcare decision-making severely constrain the implementation and reach of sustainability of community action. We have 2 documents related to this study which you can access through the QR code on the slide and also through the links that will be shared in the chat. The first document is the technical report for this research study, and the second one is a docu-slide, which is an abridged version of the report in slide format. Thank you.
Thank you so much, Martha. And now we'll hear from all of you again and take a few minutes to do that using Mentimeter. As usual, please go back to where you left off on Mentimeter, or if you need to rejoin us, please go to menti.com and enter the code you see on your screen, or use the QR code to take you to Mentimeter. Wonderful. Thanks so much for utilizing that thumbs up and letting us know you're back with us on Mentimeter. So now that Martha has just shared some of our findings related to our study of the community capacity strengthening model, given what she just shared in terms of recommendations and key findings, a first question to all of you. Which challenges to the sustainability of models such as a community capacity strengthening approach have you encountered in your work? Have they been financially related, logistically related? Have they been human resource constraints, or none of the above? And sometimes it's more than one. So this actually, you can share more than one answer for it. Great, so it looks like a fair number of human resource constraints and then financial constraints, followed by some logistical constraints. So similar challenges we think you all are experiencing that were found through our study of the CCS model. And so as a next question, in a short sentence, can you tell us what other barriers you've encountered related to the sustainability of models, such as the community capacity strengthening model, from your work? And again, you'll type a short sentence and you can hit submit, and then you'll see the responses appear here on the screen as they come in. Great. So looking at several barriers coming in, and Martha, I believe you're on the line. Happy to have you reflect on any one of these, but some of what I'm seeing in terms of coalescing is around sort of what happens afterwards, and in particular on the research side. So you know, donors needing to have a longer time frame to see the sustainable results. And I know you've reflected on that, and wondering if you can share some of that.
Yes, thank you, Amanda. I think that's a key point. It's important to note that when we're conducting this kind of research, and we're doing so at midpoint or even at the end of the project, we're not really fully understanding what contributes to sustainability, because of course, to do that, you would really have to come back to these communities a year, 2, 3, maybe 5 years after the end of the project, and really try to understand what are the elements that have contributed to the health gains, but also the ability to continue implementing activities? What has contributed to that if done successfully, or what has contributed to that not continuing? And so that's a really important point. And the other one that I see in some of these answers is the importance of having coordinated efforts. We understand that there are donors, that there is government counterparts, that there are implementing partners. So this is quite a complex ecosystem of actors. And I think we understand that without very careful coordination of all of these different stakeholders, it's really difficult to think about sustainability beyond the life of a project. And so there's many thoughts, frameworks, initiatives that are going on right now to try to understand and also fine-tune this coordination for sustained gains. And so I think that's really important. Thank you.
Thanks, Martha. And thank you to everyone for your participation again in Mentimeter. Keep it close by. We'll use it again in a few minutes. And now we're going to go back over to Adaptayo to share some findings from our evaluation of a public sector capacity strengthening approach.
As a third component and recent addition to strengthening our understanding of the intersection between individual, community, and institutional influences was a qualitative evaluation of Breakthrough Action Nigeria's public sector capacity strengthening approach. This approach, as part of Breakthrough Action Nigeria's SBC program, has 4 strategic objectives. First, support key Ministry of Health units to strengthen coordination, planning, and quality assurance for SBC at national and subnational levels. Second, strengthen public sector systems for oversight and coordination of SBC at national and subnational levels. Third, improve the quality and impact of SBC activities across the public sector by establishing improved systems and data use for coordination and joint planning. And finally, develop mechanisms for ensuring SBC quality assurance and establishing consensus agendas. Using an outcome harvesting approach and most significant change technique, our evaluation of the public sector capacity strengthening efforts resulted in several key findings, 4 of which are highlighted here. The first 3 are organized around the 3 levels of outcome examined as part of the study, which are at the individual level, organization level, and system level. First, we found that the individual level outcomes were mainly focused on initial actions undertaken to develop health messages and adapt national guidelines to support healthy behaviors and improved health outcomes. Next, we found that the approach strengthened training and facilitation, community mobilization, and design and monitoring. We also found a smaller set of system-level outcomes focused on strengthened coordination and guideline adherence. Yet, there were some challenges identified that may be barrier to implementing the skills gained through the capacity strengthening approach, such as illiteracy, resistance to change, financial and mobility issues that may limit what can be done, a lack of data collection equipment for monitoring and adaptation, and conflicting work plans across areas of the public sector that may not routinely talk to each other and coordinate. Overall, several recommendations emerged. The first recommendation was to investigate and address limiting factors that could lead to slow implementation of SBC PSCS activities. An important finding of this study was the small number of outcomes identified in Kebbi State during the activity years under consideration in this study. Compared to other states, Kebbi appeared to be left behind. We encourage the implementers of this approach to look into whether there are factors in the enabling environment that presented enhanced or different barriers to this approach, or whether the barriers might be more process-oriented. Second, coordination efforts should be increased to ensure even greater synergy between state ministries of health and related ministries, departments, and agencies. The findings of this study showed that coordination activities were least implemented. To ensure that MDAs provide stronger oversight and guarantee the long-term sustainability of activities and consequent gain even after the lifespan of the project, is crucial to ramp up efforts in this area. And third, there needs to be a greater focus on individual and systemic efforts to create balance and optimal achievement of the capacity strengthening approach strategic goals. When implemented outcomes were compared using the SBCC ecosystem levels, it was evident that the most project activities occurred at the organization level. While the organization level is critical in the ecosystem, it's equally crucial to increase activity at the system level to ensure long-term ownership of programs and sustainability of project gains. To read more about these findings, please use the QR code to take you to a page where you can share your email address and receive the final study report as soon as it's available.
Thank you, Adebayo, and please do use the QR code to receive that report as soon as it's hot off the press. A few more questions to hear from all of you using Mentimeter. So please go back to where you left off on Mentimeter, or if you need to rejoin us, go to menti.com and enter the code or scan the QR code to take you to Menti. Great. It looks like some of you are rejoining us again over on Mentimeter. And now that we've heard some of the key findings and recommendations from our evaluation of the public sector capacity strengthening model, a question to all of you. So this is a different type of question on Mentimeter, but when thinking about the enabling environment ecosystem, from your perspective, how hard is it to strengthen public sector capacity at each of these levels? You heard Adetayo talk about individual level outcomes, organization level outcomes, and system level outcomes. But from your experience, from extremely challenging to not difficult at all, somewhere in between, how hard is it to strengthen public sector capacity at each of these levels? We will use the sliding scale for each of those levels and press submit, and we'll see the results live on the screen here. So as these are coming in, it seems that the system level is staying pretty firm over towards that extremely challenging side. And Adetayo, I was hoping you could spend another minute reflecting on these responses, sort of given the differences in the number of outcomes you observed in the PSCS study, and sort of the few system level outcomes seems to align with what people are saying. So wouldn't mind reflecting for just a minute.
Yeah, thank you very much. I agree with what we are saying. Is definitely, from what we did, is definitely harder as we go up. The difficulty increases. It's easier I believe from what we've seen, is easier at individual level vis-a-vis, like comparing it to organizational and system level. But from what we found on the field, there were more outcomes or more activities going on at organization level. Again, that could be as a result of so many things, but we also felt that it could be part of the strategy to focus on the organization as, as a point to connect both individual and systemic levels, if you will.
Great. Thank you for that reflection, Adetayo, and thank you to all of you for your continued participation in Mentimeter. Please keep it close by. We'll have one more participation exercise in Mentimeter, but for right now, let's head back over to our exploration of SBC and the enabling environment evidence through our next schema section.
SBC approaches that address barriers that can result in differential exposure to SBC activities can employ more effective and inclusive engagement strategies to foster empowered family planning decision-making for women, couples, and youth. Critical to SBC's successful support of family planning programs is both understanding which channels to use to reach target audiences, and Breakthrough Research has developed several tools you can use for this kind of SBC measurement, shared in last month's webinar, as well as understanding how structural barriers in the enabling environment may impact exposure. For example, economic conditions may be a barrier to ownership of assets that facilitate exposure to SBC campaigns, such as TVs and radios. Or gender norms might result in differential access to who listens to radio or watches TV. SBC approaches to support family planning programs need to align this understanding of these barriers in the enabling environment and the potential effect on their ability to reach their target audience. This nexus of the enabling environment in SBC is bidirectional. The enabling environment can act on interventions to facilitate or constrain their effects, while interventions can work to create a more supportive enabling environment and break down barriers to healthy behaviors. While this is well known, untangling this continues to be a thorny issue and directly affects the very considered trade-offs SBC approaches and programs need to make to support family planning, such as between what is quote-unquote cheapest and what might reach your target audience more effectively. Breakthrough Research has taken several approaches as part of evaluations of SBC programming to inform the campaigns in reaching their target audience. To illustrate this, we draw on examples from 3 of our portfolios of work. Through a household-based survey in Niger as part of our RISE 2 evaluation, findings indicated low levels of access to television, but higher access to radio and mobile phones, though overall still low in all study areas. There were also gender differences. 2/3 of women had not listened to the radio compared to just 1/5 of men. One potential implication of this differential in access to this channel was that radio campaigns would reach more men than women, but that radio could be an effective male engagement strategy. Overall, the main recommendation from these findings was for the RISE 2 program to consider community-based and interpersonal communication approaches. Similarly, through our household-based BSS baseline survey in Nigeria, radio listenership among women was found to be varied across the different study sites, ranging from 24% to 38%, and exposure to other forms of media such as television, internet, and mobile phones was much lower. Awareness of the intervention radio program was significantly lower in poorest households than in wealthiest households across the study areas. These findings help to suggest that the SBC campaign's radio program may not penetrate to the poorest households that have demonstrably worse health outcomes, and that the campaign would need to assure that additional outreach efforts through other channels or methods, such as household visits or community events, were targeted at these areas, or consider ways to bring radios to communities, for example, listening or discussion groups. And finally, breakthrough research used social listening and social media monitoring to evaluate an online SBC campaign in Francophone West Africa. Social media monitoring is a key tool to understanding whether a campaign's content is reaching the intended audience online. This evaluation found a skew in audience reach. 72% of the audience was male, and yet the target audience for the campaign was both males and females. Findings like these are critical adaptive management tools over a course of a campaign to ensure reach to the right audience through the right channels. These examples come from larger bodies of work. Use these QR codes to explore more. Next, over to Leanne and then to Adelor to share how some of this information just shared from baseline surveys in Niger and in Nigeria help to identify strategies for engaging men in family planning.
Hello, my name is Leanne Doherty, and I will be sharing some of our evidence related to employing SBC strategies to engage men in family planning. In both Niger and Nigeria, gender dynamics influence decision-making about health behaviors and outcomes. Social norms and women's lack of agency in decision-making challenge efforts to meet women's family planning needs in the region. Baseline findings from breakthrough research evaluations in both countries suggested potential differential exposure to campaign content based on access to things like radio and TV, and the need to employ approaches that reach husbands and wives to encourage spousal communication around healthcare decision-making. In Niger, implementing partners rely on a variety of SBC approaches to engage men, including community engagement, radio, interpersonal communication through peer group activities, including husband schools. Husband schools are designed to share information through a community-based approach in order to shift gender dynamics by encouraging male involvement in household responsibilities and increasing couples communication and joint decision-making related to maternal and child health. Qualitative research from Niger found that by employing SBC strategies, such as husband schools, to engage men in Niger, can help men to reflect on their role in health decisions and encourage them to support their wives. As shared in this quote, "Health issues are discussed at almost every moment between my wife and me, especially when we are trained on a new topic at the husband's school. The most recent example is that of a delivery that she made at home, and I was very unhappy about this because my friends from the husband's school had asked me why."
Thanks, Leanne. And now over to Adeline.
A key strategy of breakthrough action and their Being Shirinku campaign is to create favorable attitudes towards FP and for bed spacing in particular. The campaign has messages that talk about the health benefits of using contraception to space births, both for mothers and for future children. So to see if the campaign was effective, we looked at how exposure to the campaign, that is seeing, hearing, or reading any Being Shirinku messages, or being exposed to breakthrough action community dialogues or community health workers, was related to the approval of contraception, both for husbands and wives. We looked at 4 possible scenarios. If neither partner is exposed to Being Shirinku, if both are exposed, or if one or the other is exposed. And as suspected, we found that our approval of contraception was higher if both partners were exposed to Being Shirinku, relative to the case when neither is exposed. That is, for couples in which both partners were exposed, 39% of wives and 26% of husbands approved of FP. That was an increase of 5 percentage points for wives and 11 percentage points for husbands, relative to the case if neither was exposed. And this shows clearly that exposure has benefits. But what was surprising is the importance of husbands' exposure on women's attitudes. The likelihood that a woman would approve of contraception was actually highest if her husband was exposed to Being Shirinku. That's approximately 42%. But she wasn't. This was even greater than if she alone was exposed or if both partners were exposed. Hence, an SBC approach that also includes men as targets is clearly warranted. The fact that a husband's exposure to SBC messaging is important to a wife's attitude becomes crucial when we look at the effects of a wife's attitudes, meaning a wife's approval of FP, on actual contraceptive use. In this case, we see that a wife's approval of FP is critical to use. Only 5% of women were predicted to be using modern contraception if only the husband approved of FP, versus 21% if only she approved. So, her approval increases the likelihood of using contraception by at least 4 times, but we can do even better. As you can see, the likelihood of contraceptive use increases to 31% if the couple is concordant in their support of FP. That is a 6-fold increase. Consequently, this study shows that SBC programs targeting jointly contingent outcomes in a setting where women have limited autonomy can be more effective if messaging is tailored to both partners and particularly to husbands. Please kindly use the QR code to dive deeper into the evidence.
Now that we've shared some of the state-of-the-art evidence produced by breakthrough research over the past 6 years, let's look forward to the future and what's needed next. Stakeholders, including communities, need to be engaged in the design and coordination of SBC approaches and family planning programs, and investments made in long-term evaluations to ensure collaboration with the enabling environment, promote accountability, and sustain positive change. In particular, community capacity strengthening approaches appear to yield positive outcomes. Yet, to fully understand their impact, particularly on intermediate determinants that can take time to change, support for investments into long-term evaluations are needed. Evaluations that are too short-term in nature risk undervaluing the potential impact of these community strengthening approaches, including on more entrenched indicators. When using these approaches, there must also be mechanisms in place for communities to hold governments and institutions accountable. Second, a clear threat to the sustainability of SBC approaches that engage communities and other local stakeholders and actors is a lack of sustained financing for these efforts, particularly after donor funding ends. Domestic public financing is a key high-impact practice to both allow for the continuation of successful SBC activities in support of family planning programs, and also the funding needed to address community-identified barriers that require monetary resources. Next, agency and empowerment are under-measured intermediate determinants, but a key link along the pathway from knowledge to behavior that can address, shift, and overcome entrenched gender norms that can be barriers to the use of family planning. Clear definitions and identified measures of agency and empowerment are urgently needed, and their routine incorporation into behavioral theories of change for monitoring and evaluation of SBC approaches in family planning programs is vital. And finally, as the focus on integration continues to grow, the evidence gaps identified in the RLA for integrated SBC programming remain relevant. Continued and strengthened understanding of the similarities and differences of the influence of the enabling environment on different health behaviors, and the potential unintended positive and negative consequences of integration will provide key evidence needed to address how improving the enabling environment for one behavior influences other behaviors.
So now that we've highlighted some of what's needed next to continue to advance our understanding of SBC and the enabling environment for family planning, I'm delighted to turn things over to Foyeke again to reflect on these. Foyeke, thanks so much for continuing to be here with us. And can you reflect from the perspective of a donor and someone at a USAID mission on how donors or missions can take these recommendations and drive them forward, and why it's important to do so?
Thank you so much, Amanda, and I hope you can all hear me again. Really big thank you to all the presenters for, such rich, sharing of all of the insights and evidence from the multiple countries, Nigeria and Niger, that have been shared here today about the importance of SBC approaches in creating enabling environments of family planning. So I think, I first must acknowledge that many of the recommendations that have been offered are very, very salient. And I do agree that there are opportunities that can be explored to advance them. So for instance, with regards to domestic public financing, which, as you allude to, is an enabling environment high impact practice, I think it's really important that USAID missions and donors writ large continue to work with with governments and country programs to increase both the contributions in terms of the absolute amount, but also the value of public expenditure on family planning and reproductive health. So most country programs already or continue to increasingly acknowledge the investment case for family planning as the best buy for reducing maternal morbidity and mortality. However, I think such investment cases could be made a bit more intentional about proposing the evidence on balanced financing for the multiple components of family planning programs. So rather than continuing to skew financing towards service delivery, that equal attention is paid to SBC and demand generation, commodity logistics and supply, capacity building, enabling environment, a more holistic approach to, balancing out the financing using the available resources. I think, donors and missions should also continue to invest in, fiscal space analysis because countries continue to compete, resources, especially in resource-constrained settings, resources are not always infinite, but, by investing in a fiscal space assessment, you could fund innovative financing strategies that include a mix of, public and private financing sources, not just within the health sector, but also outside of the health sector, given that, we now know that the enabling environment requires a multi-sectoral whole of system approach to to programming, but also financing strategies that include a mix of both budgetary and non-budgetary sources. So in Nigeria, for example, the mission, in addition to our historic and traditional support to increasing budgeting allocations to family planning at both national and subnational levels, we're more actively supporting the inclusion of contraceptive commodities and services within the benefit package of the country's innovative basic primary healthcare provision fund and insurance schemes, that offer financial risk protections to the poorest of the poor. And we're doing this through direct technical assistance and, through our implementing partner support. So I think summarily on that one particular recommendation, we need to balance, the level of effort and investment in helping country programs move from budget formulation to budget execution and making sure that allocated budgets are spent fully and on time, and actually to budget monitoring and making sure that, resources are optimized and used in the most cost-effective way to maximize impact for family planning. And I think, as you rightly alluded with another recommendation, complementing those kinds of investments with demand-side, community, citizen-led governance approaches will be very critical to improving accountability as well. So I think the only other one I will touch on will be that point you raised about increasing supports for investment in longer term evaluations. And I'm reflecting on some of the thoughts and comments that were provided during the Menti survey following the presentation on the sustainability study in Nigeria, and really acknowledging the limitations that come with evaluating such a longer term outcome of sustainability within a 3 to 5 year time frame of implementation, and the need to definitely invest in additional assessments 2 to 3 years down the line following implementation to actually assess what domains of sustainability subsist and which ones might have waned off after a period of time. So I think we do have an opportunity, as well as missions and as donors, to be a bit more flexible in the design of our SBC research awards and programs in a way that allow us to be a bit more intentional in the longer term in collecting the kinds of evidence that help us to continue to build on what we already know about measures like sustainability, measures like agency and empowerment, which you also mentioned. I believe that USAID has and definitely will continue to play a significant role in defining and refining metrics and research, but because agency and empowerment can be such subjective social constructs, I think it's going to be really important as well that missions will have to continue to invest in playing a critical role in not just applying what's available globally, but in defining, refining and adapting such metrics to the country context within which we support. So I'll stop here and I'm happy to engage. Thank you.
Thanks so much, Boyake. You've given us a lot to think about, and I hope everyone who has joined here today is also thinking about how they might take some of this forward in their own work and use some of the resources shared today. So before we dive into Q&A, just a final visit to Mentimeter. So please go back to where you left off on Mentimeter, or if you need to rejoin us, you can go to menti.com and use the code on the screen or use the QR code to take you to Mentimeter. We'll go back there for just the final 2 questions. Great. So we've shared what we've been doing. We'd love to hear in a short sentence from you all how your SBC work has tried to create a more supportive, enabling environment for family planning. We'd love to hear a little bit about what you all have been doing. Just in a short sentence, type that out, hit submit, and we'll see some responses on the screen. You know, it's hard to summarize work in short sentences. Great. It's great to see the diverse work that's happening, and for the person that has yet to implement such activities, hopefully some of the resources shared in the evidence can help make the case for investing in these activities to support our program. So as a final question for today, in one word, what do you hope is next for SBC and the enabling environment for family planning? So unlike a short sentence, a single word, and we'll see what the future holds for us. Great, and as people are filling in their one word for what they hope is next for SBC and the enabling environment for family planning, we'll go ahead and answer some of the questions that we've seen come in the chat. So if you have any questions about what's been shared, please post a question in the chat and we'll answer as many questions as we can with the time remaining and follow up with answers to those questions that we're not able to get to today when we send out our follow-up email for the webinar. So a first question, I think, comes back one to something that is in our call to action, or is in our what's needed next, and that Foyeke just addressed, but also Martha that you addressed earlier from the CCS study. So the question has come in, how much research is being done 3 to 5 years later to study the sustainability of impact? That's very important. And I see a follow-up question to that. I'll pluck one of them out. So, and what needs to happen for donors to invest in studies related to long-term sustainability? Not an easy question, but Martha, if you can provide any reflections there.
Thank you, Amanda. In terms of how much, it's hard for me to answer that question. I'd be curious just to know from USAID's perspective how, what percentage of research funded is going towards this kind of longer term post-implementation research. But as far as what I think would be needed, I do think that donor coordination would be something that we would need to see happen. Longer term thinking in terms of different programs being implemented within same geographical regions. We know that these decisions are usually done in collaboration with the government as well. And so having kind of longer term strategies for how are we going to look at this in the longer term, and having shared costs, having shared evaluation experiences, I think is something that would be very cost effective for all involved. And so again, I can't speak for donors, but I'm curious to know to what extent that does happen in donor conversations. Thank you.
Thanks, Martha. And I know, Foyeke, you had mentioned it in your reflections. Didn't know if you had anything you wanted to add there. Don't mean to put you on the spot, but if there's anything from the donor side in terms of what needs to happen for that investment.
Yeah, thank you, Amanda, and I completely agree with Martha. I think, there's a lot of donor coordination platforms that already exist that can definitely be leveraged to be a bit more intentional towards SBC research. I think, more broadly, we've been a bit more proactive in looking at shared investment agendas for programs, and I think expanding that to think about measurements and, longer term evaluations is definitely something that's doable. I mean, I think the evidence does suggest and makes a strong case for why that needs to begin to happen at country level, and hopefully with the government at the driver's seat, so that we can minimize duplications and be more intentional in how our evidence and all of those kinds of evaluations are supporting not just programs, but policies as well. Thank you.
Thanks, Foyeke. And as we've been chatting, our word cloud has developed, and so we see lots of different words for what we hope is next for SBC and the enabling environment for family planning. From the breakthrough research perspective, we hope some of the evidence that we've shared today helps to drive this forward in terms of what's next, but also a call to all of you on the webinar to take some of this work forward and to think about how to increase and enhance this understanding of the intersection between SBC and the enabling environment so we can achieve our family planning goals and outcomes. So we'll answer any remaining questions in our follow-up email. I'm conscious of time, but please, if you have any other questions, please do drop those in the chat before we end today. And finally, just want to thank everyone on the webinar for an engaging discussion and for being with us for this hour and a half. You can use this QR code to access an accompanying legacy resource document that has the resources that we've shared that you can dive into the evidence. It'll also be shared as a link in the chat now and by email as part of the follow-up to this webinar. And finally, thank you again so much for joining us today. Please do join us again one final time in this Legacy and Learning event series. Please join us on April 19th to discuss costing for family planning SBC. We look forward to seeing you then, and thank you and have a wonderful rest of your day.